Hi students, I am Dr. Bhavana. In this lecture we are going to deal about the continuation of the topic that is called as human health and diseases. So in human health and diseases basically we have started with numerous type. What is health? What are the common infectious diseases which you see in humans? What are the diseases and what are the bacterium which cause diseases? Then we have started with the most important topic that is called as immunity. Every year they will ask numerous neat questions based on this immunity only. So immunity is very important in neat aspect of view, as well as the what are the common diseases as well as what are the bacterial diseases also. They will ask what are the questions that are related. So now I am going to continue about the topic called as immunity. Every day we will see so many infectious diseases or else numerous pathogens will be seen mostly. But which only few will cause disease, few will not cause a disease. Why few will only cause disease? Because if our immune system that time when it is low, we are more susceptible. Or if pathogens are many and they are entering their body, then we are most susceptible to infections. Or else our immune system which is present in the body, it will act against the foreign particles and provide us the safety to go forward and all. And numerous diseases also will not occur. Why this all will happen? Only few will cause disease and few will not cause disease. Few will not cause disease because there is a special thing that is present which will help the foreign particles from not entering our body. That is nothing but immunity. Immunity. So basically there are two types of immunity. The first one is innate immunity. The second one is acquired immunity. So innate immunity as well as acquired immunity. Innate immunity means what? Innate immunity is present at the birth itself. It is present at birth. Whereas acquired immunity later in the later stages it will develop. Later stages. This is present at birth, as well as this is non-specific type of difference. It is non-specific. Whereas acquired immunity, it is specific type of difference. Specific. Present at birth as well as non-specific. This will occur later and this is called as memory type of immunity. Acquired immunity is also called as memory type. And this will occur later as well as this is specific type of immunity which is usually seen. So these are the main two differences between innate immunity as well as acquired immunity. Innate means which is present at the birth. Acquired means in the later stages you will see. And this is non-specific. You will not know which pathogen will cause this and which it is non-specific. Only this pathogen if it comes, like under acquired immunity means you will take vaccination and you will be knowing that this pathogen will not enter the body. But for innate immunity it's not like that. Any pathogen will not able to recognize. So that's why it is classified under non-specific type and this is classified under specific type. So this is about the main two differences. Then when you go into innate immunity in deeper, there are four type of barriers which are present for that of innate immunity. They are nothing but physical barriers, physiological barriers. Then the third one is cytokine barriers as well as cellular barriers. These are the four types of barriers which prevent the microorganisms from entering our body. Suppose you take it as physical barriers. What are the physical barriers which you see? The most common which everyone will know is nothing but skin. Skin is the main barrier which prevent microorganisms from entering the body. that is skin basically. So skin is a physical barrier. As well as another example, because skin is 2 to 3 layers which is present. 2 to 3 layers of skin is present, and the epithelium will not allow the foreign particles from entering our body. So this skin is usually present at birth only. So that's why it is classified under innate immunity. As well as another most important is mucosal lining of the epithelium of respiratory tract, as well as digestive tract, urinogenital tract. For everything, mucosal lining will be there. This lining is very important to not allow the foreign particles from entering our body. So mucosal lining. Next, when it comes to physiological barriers means what? Which are basically like acid in the stomach, tears from our eyes. These all are physiological barriers. And in the saliva also, mucus will be there. Mucus, that lysozyme is present, and it will help the foreign particles from not entering our body, like pharynx or larynx, anything it can't enter. So this is the physiological barrier. Mucus in the saliva, as well as tears from the eyes. Then acid in the stomach. Because these are important NEET questions, so that's why I'm stressing for you so many times. See, physical is different, physiological is different. Physical means what? The outermost layer, that is skin, mucous lining of epithelium, of respiratory tract and all, that is physical. Physiological means which is coming from inside, that is mucus which is present in the saliva. These all are substances, right? And these are all of the different types of fluids, as well as tears from the eyes which will come. But tears are also very important to protect the foreign particles from entering our body through eyes. So tears from the eyes, and from the mouth it is nothing but saliva. As well as in the stomach, if some organisms, if they are not protected in the mouth, like if they enter into the stomach, so their acid, that is nothing but HCl, also will promote the foreign particles from not entering our body. So these are the examples. I want you all to remember clearly the differences as well as the different examples that are related. So physical, physiological, as well as now cytokine as well as cellular. When it comes to cytokine barriers which are present, they are nothing but virus infected cells called as interferons. See, suppose if virus is infected for our body, the virus infected cells will secrete some protein, that is nothing but interferons. Interferons. So what is the use of these interferons? These interferons, what they will do is nothing but they will protect the non-virus infected cells. See, virus infected cells will be there, side non-virus infected cells also will be there. So they will protect the non-virus infected cells by secreting a protein, that is nothing but interferons. So important NEET question here which comes is cytokine barriers. Virus infected cells secrete a protein that is called as, they give you numerous options. It is nothing but interferons. They secrete interferons. Why they secrete interferons? To protect the non-virus infected cells from virus. They will protect the non-virus infected cells from that. So this is about the interferons. Then later it is nothing but cellular barriers. Next, what are the cellular barriers which are present? Cellular barriers are nothing but WBCs, then lymphocytes, as well as another numerous barriers are present like cellular barriers. So WBCs, lymphocytes, neutrophils, everything will protect the body. Like say, they act as cellular barriers for protecting from the infection. So these are the four types which are associated with that. Nothing but physical, physiological, cytokine as well as cellular barriers. These are the four type of barriers which play a very important role in innate immunity. Innate immunity is different, acquired immunity is different. I just want you all to remember the basic differences between acquired immunity as well as innate immunity. Then later you should remember what are the four different types which are associated with that. What are the four types which are present in that of innate immunity? Don't get so much confused. Simple. Physical is skin as well as numerous mucosal linings. When it comes to physiological, physiological means mucus in the saliva through as well as acid in the stomach, tears from eyes. Physical is different, physiological is different. Next, when you come to cytokine barriers which are present. Cytokine barriers means nothing but they are interferons only. Virus infected cells secrete proteins that are called as interferons which protect the non-infected cells. Then later cellular barriers, cells, that is WBC, neutrophils as well as lymphocytes. These all play an important role in that of innate immunity. Next, when we are going into acquired immunity, so when you come to acquired immunity, it is, we already told you, it is specific type and it is memory. That is, basically by the memory only this will act, this will develop in the later stages. So after innate immunity, the next important is acquired immunity. We acquire when we get a disease only, we acquire this immunity. So this is acquired immunity, or else in some later years also you may acquire this. Those all are naturally present at birth. These afterwards, after birth, they will develop. So this type is called as acquired immunity. So basically there are two types of responses in that of acquired immunity. They are nothing but primary response as well as secondary response. Primary, secondary. Primary response is nothing but primary, that is when the host encounters the pathogen for the first time, that is we are called the host. If we acquire if we see the pathogen for the first time, then a response will be developed in our body. That is nothing but primary response. That's why by name only we can understand. That is primary response. When it comes to secondary response, it is nothing but if the pathogen is encountered for the second time by the host, then it is called a secondary response. Primary means first time, secondary means pathogen will come and attack for the second time. So that is secondary. Primary is different, secondary is different. Primary for the first time, secondary for the second time. So these two responses are mainly mediated by two types of lymphocytes. They are nothing but B and T lymphocytes. B and T lymphocytes will encounter this responses are usually produced by B and T lymphocytes. What are these B and T lymphocytes? Lymphocytes which will act to produce the antibodies are nothing but these B and T lymphocytes. By this B and T lymphocytes only we all will get immunity. So these will play a very important role in these two responses, that is primary response as well as secondary response. And the another important point that you all should remember is B lymphocytes will secrete antibodies. Antigens means what? What is an antigen? What is an antibody? Antigen is nothing but the foreign substance which will enter our body. Some antigens, self antigens also will present in our body, but mostly if you come to definition, it is nothing but The foreign particles which will enter our body are called as antigens. But antibodies means the body will produce the specific type of immune cells that are nothing but antibodies, which will protect our body from these different antigens. So these antibodies will act to against the antigens to provide immunity. Antibodies, they are produced by our body cells only. That is nothing but B lymphocytes will produce antibodies. Antigens means foreign particles. Remember only these 2 points. Antigens means they are acquired from others, that is foreign particles. Antibodies means which will protect our body. They are nothing but antibodies. So B lymphocytes as well as T lymphocytes play an important role in producing antibodies. Mainly B lymphocytes only will produce antibodies, whereas T lymphocytes will not produce antibodies. They will help the B lymphocytes to produce antibodies. So I want you all to be very clear regarding this. So when you come to acquired immunity, first we have seen that it is pathogen specific and this is nothing but memory type. Then later years you will acquired means by name only you can understand, it will occur during the later stages. As well as this immunity is divided into basically two responses will be produced by this immunity. They are nothing but primary as well as secondary. Primary response means what? When the pathogen is encountered for the first time, it is called as primary response. When the pathogen is encountered for the second time, it is called as secondary response. How are these mediated, these primary and secondary responses? By B and T lymphocytes. So B lymphocytes, they will produce antibodies, whereas T lymphocytes, they will not produce antibodies but will help the B lymphocytes to produce antibodies. As well as there is one specific name which B lymphocytes as well as T lymphocytes play a very important role, like immune response. B lymphocytes will play an important role in humoral immune response. Humoral immune response. When it comes to T lymphocytes, they produce the important immune response that is nothing but cell-mediated immune response. Cell-mediated. Humoral immune response means nothing but B lymphocytes will produce, because they are producing numerous antibodies, there should be one immune response which plays. So that is nothing but humoral immune response. But when it comes to T lymphocytes, it is nothing but cell-mediated immune response. That is, they will not produce antibodies but play an important role in helping to secrete the antibodies, as well as they play an important role in fighting against the immune system, that is fighting against the foreign particles. So this is B lymphocytes as well as T lymphocytes. Next, if there is some failure, basically, suppose you see many patients like heart failure, liver failure as well as and all, there is only one remedy for this, that is nothing but transplantation. So transplantation is very important in this aspect. Transplantation. Transplantation means what? Transplantation means from the donor, basically the heart or liver is transplanted to the failured patient. It may be from the dead body or it may be from the living person also. Mostly, but here mainly from the heart or the liver is usually is transported from one person to another. So here what will play an important role? The immune system only will play a very important role. The grafts, they are usually taken from the donor, that is from human beings or from animals also. Some will take, because animals and all, we all are classified under mammals only. So it's okay to take, but there is one problem here. The grafts, if they are transported from one person to another, then what should be matching is tissue as well as blood group should be matching. Tissue matching as well as blood group matching. Tissue matching as well as blood group matching. These both will play a very important role. So what I have told, if a person is suffering from heart failure or liver failure, then the transplantation should be done. So grafts from maybe human beings or from the animals, they are taken and they are transmitted to another person. Simply if you take and transmit, then our immune system will not accept, because it will produce numerous, because it will recognize that it is a foreign substance, because it will recognize it as a foreign particle only. So it will recognize and it will produce numerous antibodies against it, and again there will be a problem. It is very fatal, so many times death also will takes place. So that's why tissue matching as well as blood group matching also should be done properly before transplanting from one person to another. Before transplanting from one person to another, tissue matching and blood group. First, the blood group should match. Then the tissue. It should be very closely related individuals only. If it is closely related individuals only, it is very easy to transfer and there will be no immune system will not act against it, or else again the immune system will act and again the person will become fatal. So here what the thing that is important is tissue matching as well as blood group matching. Both are very much important, as well as immune system, that is vaccination, or that should be done basically, and immunosuppressants should be given for the person. Immunosuppressants. Basically, immunosuppressants should be given for the person before a full lifetime. This person should take the immunosuppressants. First, before the surgery takes place, first if tissue is matching as well as blood group is matching, everything is matching, then it can be transplanted from one person to another. Later, for the full lifetime of the person, he should be on immunosuppressants. Immunosuppressants like cyclosporin and all, the person should take. They are nothing but the medicines they should take, the drugs. These drugs are very important, or else our immune system will act. Immunosuppressants, by the name only you can understand that they will suppress the immune system and help the person to survive. So here immunosuppressants should be taken for the person not only before the surgery or after the surgery. For the full lifetime after it is transplanted, for the full lifetime it should be done. For kidney transplantation also, this all is required. So that's why outside numerous blood group and all, first they will check before transplanting, as well as tissue also properly it should match. Mostly, at least maximum 90% should match, because we all humans will have same type of tissue, right? So it is very easy to match also. But this procedure is usually not followed very frequently. Very in rare cases, if all is matching and if the person is going to survive and all, and if he should take immunosuppressants for the lifetime, then these procedures are mostly done, or else there is no use of this, there is very use of this, but most of them are not following this. As well as when you come to antibodies are produced, I told you. So what is the shape of the antibodies basically? So antibodies in this acquired immunity. So in this acquired immunity, these antibodies So in in this acquired immunity, the antibodies. The antibodies basically consist of two heavy chains as well as two light chains. This is the structure of antibody which I am saying. So this is the two heavy chains. Heavy chains. As well as these are the two light chains. That is nothing but H2 as well as L2 we say. H means nothing but heavy chains. L means nothing but light chains. So two light chains, two heavy chains will be there. These heavy chains are very long as well as these light chains are very short. Two heavy chains, two light chains. That's why you can say it as H2 as well as L2. Two heavy chains, two light chains. Here the antigen is captured basically between the heavy chain as well as light chain. Here the antigen is usually captured because antibodies will protect our body from antigens. So the antigens should be captured, right? So where they are captured between the heavy chains as well as light chains, there is antigen binding site that is present. So the antigens will come and bind there, and these antibodies mostly they will destroy the antigens. If they are not able to destroy the antigens, then we will get a disease. If they are able to like destroy the antigens, then we are not suffering from disease. So these antibodies are basically produced by this nothing but B lymphocytes. So this is the structure of antibody H2L2. What are the five different types of antibodies which are present? They are nothing but IgA, IgG, IgM, IgE as well as IgD. We will see later what are the specific important things which are related to these antibodies, but for now you remember what are the five type of antibodies which are present. They are nothing but IgG, A, M, E, D. GAMED. So like you can remember it as game and D. One D you can remember as well as game you can remember. So these are the five type of antibodies which play a very important role. Mostly this IgE and IgA you remember. IgA is produced from that of mother's milk. These antibodies are transferred to the fetus. So this is IgA antibody from the mother to fetus. I am giving only one small example, whereas IgE, this though you should remember very clearly. IgE means nothing but for the sensitivity and all, for the proper sensitivity as well as allergies. If there are allergies and all, this IgE only will act. If they are transferred from that of mother to fetus means mostly IgA antibodies are produced from the mother's milk and they are transferred to that of the fetus. When you say it as IgE, when they are produced during allergy and all, these IgE antibodies are produced. They are IgG and all these are not. What is Ig? It is nothing but immunoglobulin. We say it as antibodies IgG, A, M, E, D means nothing but you say it as immunoglobulin. Ig means immunoglobulin, means which protects the immune system. So five type of antibodies are present and they play a very important role in that of transferring, like when some allergy or something is present, then this IgE will act, and IgA is from mother to fetus. Rest of them we will see afterwards. Later in your MBBS and all you will learn about the rest of them. But for now, according to Neet point of view, just remember these two only, as well as it is very easy for you. So this is about the, so today we have discussed about the what is immunity, what are the two different types of immunity, and what are the antibodies which are present, what is the structure of antibody, and if there is a transplantation, how it will take place, and the person should be taking immunosuppressants for the full lifetime to be healthy and all that we have seen, as well as we have seen what are the two types of responses which are associated with that of acquired immune response. And then we have seen about B lymphocytes will produce humoral immunity, T lymphocytes will produce cell mediated immunity. Whatever today I have discussed, everything is very important in Neet point of view. So just read them twice or thrice to remember for the full, as well as this is very important in Neet. Numerous questions will be asked in human health and diseases, mainly in the bacterial diseases as well as immunity only. So these two you should remember very carefully. Next class we will see about the what is active immunity, passive immunity.